Introduction of bills. Minister of Health and Long-Term Care.
Thank you, Mr. Speaker. Mr. Speaker, I move that leave be given to introduce a bill entitled An Act to Safeguard Healthcare Integrity by enacting the Voluntary Blood Donations Act 2014 and by amending certain statutes with respect to the regulation of pharmacies and other matters concerning regulated health professions, and that it now be read for the first time.
Mr. Hoskins moves that leave be given to introduce a bill entitled An Act to Safeguard Healthcare Integrity by enhancing the Voluntary Blood Donations Act 2014 and by amending certain statutes with respect to the regulation of pharmacies and other matters concerning regulated health professionals, and it now be read for the first time. Is the pleasure of the House the motion carried? Carried.
This is a bill entitled An Act to Safeguard Healthcare Integrity by enacting the Voluntary Blood Donations Act 2014 and by amending certain statutes with respect to the regulation of pharmacies and other matters concerning regulated health professions. First reading of the bill, Premier lectured, projet de loi.
For a short statement.
Thank you, Mr. Speaker. Today it's my pleasure to introduce the Safeguarding Healthcare Integrity Act 2014 that will, if passed, combine two previously introduced pieces of health legislation that died on the order paper in the spring. The proposed legislation links together our government's actions to prohibit the compensation of blood and plasma donors in Ontario with the regulation of hospital pharmacies and other matters concerning the health professions regulatory system. So very, very briefly, let me start with blood donation, then move to the regulation of hospital pharmacies. Every year, thousands of Ontarians voluntarily give blood and plasma to help others survive accidents, surgery, or life-threatening conditions. Our position remains crystal clear. We stand firmly against payment for blood or plasma donations in Ontario. The second part of the bill is our government's response to a very serious incident that occurred last year when 1,019 patients in Ontario received weaker doses of chemotherapy drugs than had been prescribed. Our proposed legislation, if passed, will amend the Drug and Pharmacies Regulation Act so as to allow the Ontario College of Pharmacists to inspect and license all hospital pharmacies operating in Ontario as a means to ensure that medication management and processing systems in hospital pharmacies are standardized. At the same time, I'm introducing additional amendments to the Regulated Health Professions Act 1991 and the Public Hospitals Act that will enhance communications among health systems partners, including health regulatory colleges, public hospitals, and others to strengthen oversight and better protect patients. Speaker, I'm confident that all members can stand behind this proposed legislation. Thank you.
Thank you. Introduction of bills.